welcome to Paediatrics Simplified. In today's video, we are going to discuss about febrile seizure. What is febrile seizure? Why febrile seizure is more common in children? What is the etiology of febrile seizure? What are the symptoms of febrile seizure? What is the pathogenesis of febrile seizure? And what are the types of febrile seizure? So let's get started. So here are some important definitions. What is seizure and what is convulsion? Okay, seizure is a sudden and abnormal and uncontrolled burst of electric activity in the brain, which temporarily affects a person's consciousness or muscle control or behavior. So basically, seizure is a sudden and abnormal burst of electric discharge in brain. What is convulsion? Convulsion is an external physical manifestation of seizure. It is a sudden and violent and involuntary contraction or a series of contraction and relaxation of muscle. So convulsion is basically an external physical manifestation of seizure. So convulsion in layman terms is also called as fits. So parents often tell that my child is having fits. And if in convulsion there is involuntary contraction of muscles, then it will manifest as, and if there is series of contraction and relaxation of muscle, then it will manifest as jerky movements. Pediatric population seizure are more common. In adults, usually we see that seizure is very rare, but in children, seizure is way too common. If you go to a pediatric emergency room or if you're working in pediatric department, you will see seizure cases almost regularly, and febrile seizure is one of the most common cause of seizure in pediatrics. Okay, so what is the definition of febrile seizure? Febrile seizure is a seizure accompanied by fever. That is the simplest definition. But it has four other criteria which need to be met. One is temperature during seizure is more than 38 degrees Celsius or more than 100.4 degree Fahrenheit. Okay, the minimum temperature should be 100.4 degree Fahrenheit to call it a febrile seizure. But sometimes what will happen, there will be the seizure will come few hours after the seizure. Child will first present with seizure and few hours after that there will be seizure. Okay, so that also you will call it a febrile seizure. It is very rare. Then second criteria is the age of the infant or child should be between 6 months to 5 years of age. Okay, so some books define it as 6 years of age also. So if age is less than 6 months or more than 5 years, then other differential diagnosis you need to exclude, then it is not febrile seizure. Okay, if age is less than 6 months or more than 5 years and child is getting fever with seizure, then it is not febrile seizure. Another criteria is the fever and seizure is not due to any underlying CNS infection or metabolic disturbance. If that is the case, then the diagnosis will be different. It is not febrile seizure if there is any underlying pathology is there. Okay, and the last criteria is in the absence of previous afebrile seizure. If child has afebrile seizure previously and now child is getting febrile fever with seizure, you cannot call it as febrile seizure. What is the epidemiology of febrile seizure? Febrile seizure is very common in children. Around 2 to 5% of all infant and children are suffering from febrile seizure. So on an average, the percentage will be around 4%. So that is 1 out of every 25 healthy infant and children will suffer from febrile seizure. Then the age group of febrile seizure is between 6 months to 5 years of age. And most common age group is between 12 to 18 month. That is the most common age group. So what are the etiology of febrile seizure? First is infectious agent. So infectious agent will cause fever that will lead to febrile seizure. So what could be the infectious agent? One is roseola or HHV6 that will cause roseola infection. When child will have exanthem, viral exanthematous RAS. Second is HHV7. Third is parainfluenza. Then influenza and adenovirus. So these are most common organism causing febrile seizure. Actually any infectious agent can cause. The infectious agent can be viral or bacterial. Any infection that will cause fever may lead to febrile seizure. So viral cause is around 90%. So around 90% are viral causes and most common viruses are these 5. So this is about infection. So next comes immunization. In immunization, there are many vaccines that can cause fever and febrile seizure. One is DPT, then another is measles, then MMR plus V stands for varicella, then MMRV. MMR separately will also cause febrile seizure. But when we compare both of these, if MMR and varicella given separately versus MMR and varicella given as quadrivalent vaccine, this has 2 times more chances of causing febrile seizure. Okay. So better to give MMR and varicella separately. But here important thing to notice is that immunization as such will not cause febrile seizure. Immunization will lead to fever and that fever will cause febrile seizure. Immunization is not the direct cause of seizure. So if febrile seizure happens, there is nothing to worry. Iron deficiency, then next comes to genetic predisposition. So talking about genetic predisposition, febrile seizure is runs in family first thing. Okay. So in one family, many members are affected with febrile seizure. Like uh, often parents bring a child and one of the parents will be or one of the sibling will be suffering from febrile seizure. This can happen. So febrile seizure, first of all, it runs in family. That gives a clue that some genetic factor might be there, must be there. And second thing is, out of mm, out of 100 children, 4 children are only suffering. So that means those 4 children, those children are predisposed. Those children are genetically predisposed to cause to have febrile seizure, right? And this genetic wise, febrile seizure is polygenic. So there are maybe many genes associated in febrile seizure. Some of the common and important genes are Feb1, Feb2, Feb3, and Feb4. Another is P43Q mutation. Then SCN1A mutation, SCN1B, SCN9A. So these are the genes. SCA1 is the gene that is um, found in Dravet syndrome. We'll come later what is Dravet syndrome, but remember this thing, that the SCN1 is the gene commonly involved in 80% cases of Dravet syndrome, right? Next comes to iron deficiency. In iron deficiency, studies have shown that iron deficiency may predispose to febrile seizure. So if serum ferritin, if we check in a person, in a child, if it is less than 30 microgram per liter, then the child is more prone to develop febrile seizure. Okay. So these are the etiology. One is infectious agent, then immunization, then genetic predisposition, and iron deficiency is also a contributory etiological factor. Then how febrile seizure happens? How febrile seizure happens and why is it more common in children? Many often people think that febrile seizure is because fever causing seizure. Actually, it is due to a chemical called as cytokines. Okay, so these cytokines are chemicals. Most important cytokines are interleukin 1 beta, interleukin 6, and interleukin 8. So these cytokines are also called as pro-inflammatory cytokines. Okay, if there is some infection or immunization, so that will lead to secretion of cytokine in the body, and these cytokines will act on the brain. In pediatric age group, particularly between 6 months to 5 years, brain is hyperexcitable. The brain cells are hyperexcitable. It is called as age dependent hyperexcitability. Age dependent hyperexcitable brain cells. So cytokines will act on those brain cells and there will be abnormal electric discharges. That abnormal electric discharge will cause febrile seizure. So there are some genetic predisposition which will stimulate, again aggravate the this action of cytokine on brain cells. So what are the genetic predisposition? Evidently some research has found that some genetic mutation will cause channelopathy. For example, sodium channel gene mutation, or GABA receptor mutation. These are the mutation, those will cause channelopathy, and this channelopathy will predispose a patient to develop febrile seizure more frequently. Okay. So this is how febrile seizure is more common in children. First, because of the cytokines. First, because of cytokine acting on age dependent hyperexcitable brain cells. So because their brain cells are hyper excitable. Second is due to some genetic predisposition. So what are the types of febrile seizure? Febrile seizure are mostly three types: simple febrile seizure, complex febrile seizure, and febrile status epilepticus. So what are the percentages? Simple febrile seizure is very common. It accounts for around 70 to 80% of all febrile seizure. Complex febrile seizure account for 20 to 30% of febrile seizure. And febrile status, that is very rare. It is almost 5% of all febrile seizure. So most of the febrile seizure are simple febrile seizure. And the duration of simple febrile seizure is less than 15 minutes. Always it is less than 15 minutes. Complex febrile seizure maybe more than equals to 15 minutes, right? And febrile status, it is more than 30 minutes. So definition wise, you call it a febrile status when the seizure lasts for more than 30 minutes, or there will be multiple seizure and child not regaining consciousness in between. So that is called febrile status epilepticus. What is the difference between simple febrile seizure and complex febrile seizure? First is the frequency of seizure. Okay, the frequency of seizure in simple febrile seizure is one episode for 24 hours. The type of seizure will be generalized seizure in all cases. The duration of seizure is less than 15 minutes. And the post-ictal state is either absent or short. Post-ictal state is the state immediately following a seizure when child will be confused or drowsy. And in simple febrile seizure, this duration will be short or absent. In complex febrile seizure, the duration, first is the frequency of seizure is more than one episode for 24 hours. It will be focal or partial or unilateral seizure. The seizure duration will be more than 15 minutes and the post-ictal state will be long. Okay. So here in simple febrile seizure, short post-ictal statement 5 to 10 minutes. In complex, the post-ictal phase is longer than 5 to 10 minutes and sometimes more than 30 minutes also. And at times child will suffer from Todd's palsy. So paralysis following seizure. So if a child's seizure, febrile seizure, satisfies any one of the following four criteria, so fulfills any one of the above criteria, then we'll term it as complex febrile seizure. So why should we classify simple versus complex febrile seizure? So the simple complex febrile seizure are classified because of the plan of management to decide that what need to be done next. Simple febrile seizure does not need any further investigation or evaluation. If it is a complex febrile seizure, it need investigation. Okay, so investigation like EEG, neuroimaging, blood test, in neuroimaging CT, MRI, these will be required. Then future recurrence of febrile seizure in complex febrile seizure, it is more compared to simple febrile seizure. The chances of febrile seizure to recur in future is more if it is a complex febrile seizure. Then future risk of epilepsy. If it is a simple febrile seizure, so what are the chances that it will become into epilepsy in future? This is very less. This is just 1%. So if it is a complex febrile seizure, epilepsy risk is between 6 to 29%. Is very high. Okay. Then mortality of simple febrile seizure is normal as that of normal population. But in complex febrile seizure, the mortality rate is 2 times more compared to general population. So compared to simple febrile seizure, complex febrile seizure has outcome are bad, you can say, and investigations and management, it needs more investigation and management. Then febrile seizure associated epilepsy. So what is febrile seizure associated epilepsy syndrome? Okay. So in febrile seizure associated epilepsy syndrome, initially the child will present with symptoms of febrile seizure. Okay, so this will happen initially, and later on it will progress into epilepsy. So that is basically when the seizure will start, it will start with fever. Later on, when the child grows up, child will develop seizure without any fever, right? So epilepsy, we need to know that epilepsy is different from febrile seizure, because epilepsy is a serious condition and it need aggressive treatment and aggressive evaluation. And in epilepsy, the seizures will be without fever. So in that way, it is different from simple febrile seizure. But febrile seizure may progress to epilepsy when we call it a febrile seizure associated epilepsy syndrome. So there are three febrile seizure associated epilepsy syndrome which are very important. One is GEFS plus, another is Dravet syndrome, and another is temporal lobe epilepsy. So these three are important febrile seizure associated epilepsy syndrome which you need to remember. Okay. So GEFS plus is generalized epilepsy with febrile seizure plus. So it is a hereditary condition. It is autosomal dominant and it runs in families. In early childhood, child will present with multiple febrile seizure, and later on it becomes afebrile seizure. So initially child will get febrile seizure, that is seizure with fever. Later on child will get only seizure without any fever, and the seizure is generalized. So the term here is generalized epilepsy. The seizure will be tonic clonic or clonic or only tonic or absence. So any type of generalized seizure. Then in mid childhood, there will occur remission. Okay, in early childhood it will start, in mid childhood there will be remission, and in between there will be generalized seizure without fever. Another condition is Dravet syndrome. Dravet syndrome is most severe form of FSES, and Dravet syndrome occur due to de novo mutation in SCN1 gene. One gene in 80% of cases. So genetic test will help in this case. The onset is at infancy period, and child develops with frequent seizures, and the seizures are unilateral, you can say unilateral seizure, right? And myoclonic type, and it will occurs in clusters, and the seizures are more prolonged. So there will be unilateral seizures. The seizures are myoclonic in time, and these are more frequent. Frequent means every 1 to 2 hours child will get seizure, and the seizure will come in clusters and last for prolonged periods. So in this way it is different from febrile seizure or simple febrile seizure. So later on child will get afebrile seizure. Okay, during second second year of life, child will get afebrile seizure, and gradually what will happen, that child will develop psychomotor delay and developmental abnormality, developmental delay. So in that way, it is a very like severe condition. And one of the differential diagnosis of Dravet syndrome is uh, differential diagnosis of Dravet syndrome is vaccine encephalopathy. Sometimes after giving vaccine also child will get seizures and which will seem like vaccine encephalopathy, but it is actually Dravet syndrome. Okay, so if you suspect vaccine encephalopathy, then you should go for genetic test and see for this SCN1A genes. In that way, you can differentiate it from vaccine encephalopathy. Next is temporal lobe epilepsy, secondary to mesial temporal sclerosis. So this is also a kind of FSES where initially child will present with febrile status, and later on when you follow up the child will develop temporal lobe epilepsy. So there are two theories here. First theory is the child develop febrile status. This is the first theory. Child will develop febrile status, and this febrile status will cause ischemia of hippocampus, and this ischemia will later lead to sclerosis of hippocampus, and this will cause mesial temporal sclerosis. Okay, this will cause this mesial temporal sclerosis and manifest as temporal lobe epilepsy. This is one theory. Because of prolonged febrile seizure or febrile status, child will develop ischemia in hippocampal region. Second theory says that initially the child will have some underlying hippocampus pathology. A hippocampus lesion that will cause or that was manifest as febrile status. So there will be underlying hippocampus lesion that will manifest as febrile seizure. Okay, and later you will find out temporal lobe epilepsy. So if you diagnose it to be temporal lobe epilepsy, or if you are suspecting temporal lobe epilepsy, to diagnose that EEG, MRI are need to be done yearly, and child should be treated yearly. Next is febrile infection related or refractory epilepsy. So which is also called as FIRES. Febrile infection related refractory epilepsy syndrome. So FIRES is a condition which is different from febrile seizure, but it will present with fever plus seizure. Okay, that's why we are mentioning it here. But the age of the child will be greater than 5-year-old male child. So it is more than 5-year-old child. So it is not febrile seizure. The child will present with fever and seizure, and the symptoms are encephalitis-like symptoms. But if you evaluate the child, you cannot find any infectious agent. Later on, this encephalitis-like presentation will progress into epilepsy, and the epilepsy is refractory. Refractory means it is very difficult to treat. Next is clinical feature of febrile seizure. So how a febrile seizure will present with? It can present with seizure or fever or any other associated symptoms also will be there. First, what are the symptoms of seizure? In seizure, child parents might not notice the child having seizure or fits. Parents may notice the child is unconscious, okay, or passed out. Child suddenly became unconscious, and that is the first complaint. Second, it may manifest as stiffness of body, limbs, or there is jerky or shaky movements of limbs or body, or there will be tongue bite, okay, clenching of teeth, and drooling of saliva, right, or there may be involuntary passage of urine and stool. Yeah, this is important. Parents will tell the child has passed urine or passed stool or did vomiting. Okay. So these are the symptoms of seizure, and the seizure symptoms may be either generalized symptoms or focal symptoms. When it is generalized symptoms, we call it generalized seizure. If it's focal, we call it focal seizure. Then next comes to fever. Fever, need to ask whether it is high fever or low grade fever. If low grade fever, child, if febrile seizure develops at low grade fever, then chances of future febrile seizure recurrence is high. Okay. So if at low fever child is developing seizure, chances that future child will develop febrile seizure is more. Also, second point is ask about duration of seizure. What is the duration of fever? Then what about associated symptoms? So in associated symptoms, child may have underlying infection. So child may present with URTI or exanthematous fever. Okay. Or maybe UTI or otitis media. These are some common presentation. Or acute gastroenteritis, or malaria can also have fever and febrile seizure. So these are, if URTI, child will present with cough, cold. If exanthematous fever, child will present with rash. If UTI, child will present with urgency of passing urine. If otitis media, child will present with ear discharge. Okay. If it is acute gastroenteritis, child will present with loose motion, vomiting. So these are the symptoms. Symptoms are of that of seizure, that of fever, or any associated symptoms. Then differential diagnosis of febrile seizure. So what are the differential diagnosis? First is acute meningitis. So if it is acute meningitis, then child will present with fever and seizure. So you must rule out meningitis. Okay, so out of all this, acute bacterial meningitis, meningitis is most important. So because it can be treated with antibiotic, and if not treated, child will develop long-term sequelae. Sometimes it is partially treated bacterial meningitis. Okay, when child will come from another hospital, child will getting treated at other clinics or hospital, and treated with antibiotic, and child's symptoms improves after that. And when the child is previously treated with antibiotic, you should keep in mind partially treated bacterial meningitis. Next differential diagnosis, encephalitis. So encephalitis, mostly it is viral encephalitis, which is presenting like fever and seizure. Then cerebral malaria. It is common in endemic population. So if endemic area a child presents with fever and seizure, then cerebral malaria must be ruled out. Epilepsy. In epilepsy, what will happen? Child will more prone to develop seizure. So this is called as fever triggered seizure. Child will get fever and child will throw up seizure. So it is fever triggered seizure in epilepsy. Another differential diagnosis is metabolic seizure. So one metabolic seizure, electrolyte imbalance can cause metabolic seizure, right? So one example is hypocalcemia. Another is glucose level, that is hypoglycemia. Hypoglycemia also can manifest with seizure. Thank you for watching today's video. There is another video on this series about management of febrile seizure, how to diagnose, how to treat, and how to prevent febrile seizure. Do watch that video too. And if you like my videos, then subscribe to my channel. Thank you.